This is such an important video because if you know what the research says about what increases your risks of type 2 diabetes, then you can work to decrease them. I'm Neris, I'm a GP. I help people achieve remission of their type 2 diabetes and pre-diabetes. Let's go. What are these risk factors? The first one I'm going to discuss is having a family history of type 2 diabetes. It's so common for people to think that diabetes is inevitable because there's a family history of it. People accept it as their destiny, feeling helpless that they can't do anything to prevent it. And yet it is true, you're more likely to develop type 2 diabetes if your mum, dad, brother or sister has it. In fact, the statistics say there's a 40% increased chance if you've got one parent affected, and it does go up to 70% chance if both parents are affected. But those statistics are only relevant if you don't do anything about it. Yes, you may have the genes, but genes can be switched on or off. And the reality is our genes haven't changed very much in millennia. But what has changed dramatically, even in the last 100 years, even less, is our environment. The types of food we eat is different. The volume of food, the frequency, and of course, the level of activity. Sleep has been affected. Our days are longer thanks to the light bulb and the addictive nature of our phones and television and Netflix. We don't stop working when we leave the office. We don't take a break on the weekends. We don't spend much time in nature, moving our bodies or interacting with the soil. These are actually the things that help our bodies work at its best. And that actually is a whole field called epigenetics. Epigenetics is the study of the effect of the environment on our genes. And in fact, it seems your environment is more important than your genes. So as mentioned, you can switch their genes on and off. So how you live your life is of critical importance. The healthier your environment, the more chance you have of that gene being switched off. Now, obviously, I have oversimplified things, but do not feel that genes are your destiny. The newer science is really saying otherwise. And the way I think about it is that your genes load the gun, but your environment pulls the trigger. But what pushes your risk of diabetes up the most? The single biggest risk factor, and the one I see most commonly as a doctor, is your weight. When it comes to your BMI, the more you weigh, the higher your risk. Your BMI is based on both the height and weight, and there's plenty of calculators online. Your target should be between 20 and 25. Higher than this, and you need to get it down. Obviously, there's restrictions with the BMI. If you're pregnant, bodybuilder, then it's not always effective. But what is important is that you know where you're storing your weight. And in particular, how much of this visceral fat do you have? The visceral fat is the fat around and inside your organs. This is the dangerous fat that is causing inflammation and ill health. The quickest way of measuring your visceral fat is actually by measuring your waist circumference. Not many people want to measure their waist circumference or even have a tape measure, but I do harp on about this to the patients in our clinics because it is the quickest and easiest way of really having an idea how much visceral fat might be hiding underneath. So take a tape measure, start by your belly button and measure all the way around just for you to have an idea. Your risks of ill health start increasing, or diabetes even, when you're over 80 centimetres or 31 inches in a female, or 94 centimetres or 37 inches for men. Remember that fat is an organ. It's not just a dumping ground. It releases hormones and chemicals. And the ones around your middle of your abdomen, it does lead to inflammation. And of course, if you have pre-diabetes and type 2 diabetes, you may well have other conditions. Other conditions that are linked to visceral fat include fatty liver, that's the big one, high blood pressure, high cholesterol. You often find that one person has many of these conditions, and it's because they're so closely linked. And of course, the best way to treat them all is to do it in one go, by decreasing the fat. And some of you might not even think you're overweight. A lot of people ask me about this. And do you know what? You might not be. You might compare yourself to your neighbour or your friend and think, she's bigger than me and she hasn't got this. And yes, that might be true. But Mrs. Jones down the road doesn't have the same genes as you. She might be storing fat differently to you. And if you've got a diagnosis of type 2 diabetes, pre-diabetes, high blood pressure, or your cholesterol isn't right, then I'm afraid your metabolism isn't right. It may well be that you're at a higher weight than your genes would like, or that you've been storing it around the organs, around the centre. So don't overthink it. It's not a judgment. Measure your waist circumference to find out and be open with yourself. If you are finding that you're slim around your waist, then of course there might be other factors at play. It's quite likely many people have. It's not just the one reason, it's more than one. So other things that increase your risk factor, I'm afraid, is gender. Men seem to be at a slightly increased risk than women. Ethnicity matters. The white population have a lower risk. Population at highest risk includes South Asian, Chinese, African, Caribbean and Black African. And of course, another risk factor is your age. The older you get, the higher your risk. And I'm afraid this is the reality. I see a good amount of older women that aren't overweight, whereby this is probably the reason why their blood sugars are creeping up. And whilst you can't do anything about your age, there are other ways to lower your blood sugar without losing weight. If you do have a diagnosis of pre-diabetes and you're under 50 years old, then unfortunately you do have a higher risk of going on to develop type 2 diabetes than somebody who goes into the pre-diabetes range in their late 70s, for example. And unfortunately, for those high-risk populations that I just mentioned, your risks go up once you go over the age of 25. We've mentioned the family history risk, and the other one is high blood pressure. This is, if you've got high blood pressure, then it does increase your risk, even if this is controlled by tablets. I think this could very well be because high blood pressure has the same root cause as type 2 diabetes. And of course, I've already mentioned that. Whilst you're unable to change your age or family history, there are things you can change. Your waist circumference being the main one. And this could have a huge impact at whatever age you might be. Don't think that if you're too old that there's nothing that can be done. There is always improvements to be made along the way.